Hello.
Hello.
Assalamualaikum.
Salam. How are you?
Good. How are you?
I'm good. Thank you
Make
so
sure I have
much for
everything else.
joining. I mean, I know you have such a
Thank
busy
you.
schedule.
Well, this summer there's not a lot of structure, and I'm just ready for school to get started. So, but thank you so much for inviting me and for really doing this. Just sharing different voices and having these really important conversations.
It's really
Thanks for
it's my pleasure to
making
have
this
you.
available.
Thank you. So let me introduce you. Dr.
Okay.
Saba Maroof Hamzavi. She is a child, adolescent, and adult psychiatrist. She practices in various outpatient settings in the Metro Detroit area. She is also the creator and the host of podcast entitled Unsung Heroes and Stories to Inspire, and it is in the third season. Tell us more about your career. How did you come to study? Um, yes, that's better. How did you come to study psychiatry and to become have a doctoral degree in it, and how long have you been practicing?
Okay. Well, I graduated from medical school in 2007, and I guess I'll backtrack a little bit there. I actually went to medical school knowing that I wanted to become a psychiatrist, and my mother's actually a psychiatrist, so I remember growing up and seeing she's a child psychiatrist, and she actually completed her training while I was in high school. So I was very aware of the kinds of how she was helping people, the kind of work she was doing, the kinds of people that she was helping and seeing. And I also remember she had a gap kind of in her training when I was as I was growing up because we moved overseas. But I remember seeing just really interesting articles and books that she had that she was always reading, and um, and it was really fascinating. I was really fascinated by kind of like how the mind works, how the brain works, relationships, attachment, child development. Um, and so I guess that kind of instilled this passion and this interest. And I thought about well, there's two ways to get to this. I can either like do what she was doing, which is psychiatry, take the medical route, or psychology. And for me, I kind of at the time felt like I wanted to take the medical route. I felt at the time that I could be versed in helping people through medication while also doing therapy, or at least supporting them through difficult times, or through their conditions. So I actually went to medical school after I got married. And that was kind of, for anyone that's out there that's applying to medical school, or, it's quite challenging. And it's a difficult time when you are on that path, when you're trying to get in, you're not really sure what's going to happen. You might not get in the first time. Do you would try again? How often, everyone says try, and try again. And eventually you'll get what you want, but that's not always the case. So, I really remember that period of insecurity when I'm talking to prospective students, and I know it's very difficult. But anyway, I did go to medical school. I attended medical school at Wayne State University while I was married. After I got married, I had my first baby as a fourth-year medical student. And then I did my residency in Detroit in psychiatry at Henry Ford, and then my fellowship in child psychiatry at Wayne State. And so my training as a psychiatrist started in about 2008. So I've been working in the field since 2008, and I completed everything in 2012. So I've kind of been on my own since that time.
Wonderful, wonderful. So again, for the whoever joining us now, I am interviewing Dr. Saba Maroof Hamzavi. She is a psychiatrist from Michigan, and please share this video and like it. People need to listen and to hear the information Dr. Maroof is providing. So tell us about the podcast that you started. That's very exciting. I went on the link, and it's really exciting. So what's the story?
Oh, thank you. Yeah, it's really interesting. So basically last year, I was invited, well, I don't even say, I had a friend this is what's interesting. I think that sometimes you have opportunities that can come from anywhere. And I actually had a friend from high school that messaged me on Facebook and was like, hey, I have a friend that has this podcast, and he's actually looking for Muslims to interview. He has kind of like a roundtable type of discussion as a theme of his podcast. And so he was looking for local Muslims to have on. And honestly, initially I was, she asked me if I'd be interested, and she connected me with him. And at first I was like, oh, I don't know. There's so many good people, especially being in the Metro Detroit area. We are surrounded by really amazing people in our community. And I thought, well, there's so many better people that could go on and answer whatever questions or have this discussion. But then I decided, I said, you know what? I I'm Muslim, and I have this experiences of the experience of being a Muslim American. I don't think you need to have a PhD in that to like be able to talk about it. So I went ahead and took the opportunity, and also extended it to some other Muslims that I knew in the area, and and I made a friend in the process. The host, his name is Calvin Moore, and he's been podcasting for a long time, for years. And I got introduced to this studio in Royal Oak called Podcast Detroit, and found out that it's really easy to have your own show. And then I had this idea. So this was actually around, it was shortly after the election. Mm-hmm. Donald Trump had been president for a few months. And ironically, the week that we had this show on, it was the week right when the Muslim ban 1.0 edition had been announced, or there was a lot of talk about it. So I think that it was also, so I had this idea, there's so much negativity. Everybody was really just still reeling from, I think, the aftermath of the election, the shock of it. And then all just like this onslaught of negative news, just every week. Right. And even still, it seems like there's just something negative in the news. And I thought, this is kind of a new medium, podcasting. And, I had this idea, it would be really cool to have a show where we're just interviewing different Muslims and how different Muslims are making an impact in various areas and arenas. And I talked to him about it. And really, actually, I was initially planning on kind of almost like pitching this idea to somebody else or that I knew, and maybe helping them come up with it. And my friend, who's now my friend Calvin, he was like, you know what, Saba? He's like, I think that you should do it. I think that you would be great, and I think you should do it. And so that's kind of how it started. And it's kind of interesting. I mean, it's really nice. The studio, like, they kind of help you a lot with the technical side of it, the logistics. But at the end of the day, you still have to take the initiative and follow through with it. They have a lot of shows that get started. And some go on for many, many episodes and seasons. Some might have a few episodes. But once I got started, I just kind of kept coming up with ideas of different people to interview. And I really opened it up too. It's not just for Muslims, but anybody that has like an inspiring story, a vision, a project, a personal, something personal that they've been through. Those are the kind of stories that I've been sharing. So it's been a really good experience. I'm actually taking a break right now. The summer, I thought it would be a little bit difficult. And I also, as I was actually, well, I'll go backtrack. Initially, when I started it, I just remember feeling so honestly terrified and scared that very first episode when we first went on. And I was like, I don't like hearing the sound of my voice. I don't know what I'm going to sound like. I don't know if anyone's going to listen to this or how it's going to turn out. And I'm sure that you've had those same kind of feelings and thoughts.
Absolutely, all the time.
With the same kind of project, right? And it's really just kind of this kind of ties into the theme of confidence. But sometimes you kind of have to feel that way, feel that vulnerability before jumping into something, as long as you've done your homework and you're prepared and you're not just jumping in blindly. But I think that made it even more rewarding for me. And so it's been really interesting. It's been a really good experience. And I'm actually thinking about continuing this podcast, or maybe possibly starting another one with more of a mental health focus, and just kind of trying to see if I can, we're just kind of thinking about it right now. But it's been a really good experience. It was just something really different for me too. As I mentioned, I'm a physician, I'm a psychiatrist, I'm a mom of 4. This was just something that was really different. It was something that I was kind of doing for me and a different kind of venture, but I felt like it was really important to share voices and stories of people that we don't get to usually hear from.
Absolutely. Yes. So when you talked about vulnerability, and how do you think someone can overcome this? Like, we all have this, we feel like we are not confident to do something, or we are scared, or we are nervous about it. How do you think someone can overcome that and just move forward regardless the fear? and the lack of certainty, if you will?
Well, I think that, as I mentioned, just being well prepared and doing all your background research, really like getting to know the topic of, in the area that you're venturing in, really doing your background research, any kind of experience or training. And talking to people, getting advice from people that have done things like this before. My friend Calvin, I asked him for advice on a number of things. A friend of mine who, she shared a bunch of websites with me and reading material, and we talked about things, and I would kind of, and even still kind of go through ideas with her or with other friends. So, really just being prepared. And then at the end of the day, knowing that you've done everything that you can to prepare for a certain, for whatever it is you're trying to go for. But also knowing when you don't, and I'll mention this later too, because professionally this comes up, but knowing when you don't know the answers. Exactly. Knowing when you need to ask somebody else for help, knowing when this is like a little bit outside your reach or your area, knowing when to refer to other people. But in terms of vulnerability, for me at that point, it was just going ahead and taking the first step. And knowing full well that I was well prepared, that I had thought about this, I put a lot of thought into it. And also actually being okay with failing at something.
So what
it's okay.
happens if you do mistakes, What happens if something didn't work? This is actually enforces our humanity, isn't so?
Oh, yes, exactly.
And as a professional, as a doctor, it's like if you do mistakes, that means you're modeling for other people that it's okay. I'm still, professional, and I do mistakes and I learn from them. I move forward. It's kind of more empowering, if you will.
Yes, it is. That's true, because if you're expecting perfection all the time, then that itself is going to sometimes keep you from trying new things.
Absolutely.
It's almost like a block, and it's unsustainable to expect that all the time. With everything that you do.
If we want to wait until everything is totally perfect, we're not going to do anything, because we can't guarantee anything to be perfect at any time. Because maybe we are on live now and maybe the power will shut down. So what are we going to do? So it's just we have to deal with it, I think, and just move forward with whatever we have. Absolutely.
Yeah.
So
yes, exactly.
Absolutely. So how, again, in terms of what you do, I know that you do a lot of also charity, or like you started a lot of practices in your area for like to provide pro bono services for mental health. Can you talk about that?
Yeah. Well, we have in Detroit, we have a clinic called Huda Clinic, and that was started, it's been more than 10 years now, in the border of people that are local know of Hamtramck in Detroit, right by the Muslim Center, and that's been going on. And I actually had the opportunity to volunteer there as a medical student, which was a great experience. And those are doctors that volunteer their time and services, and I always knew, actually, as a medical student, that if they did not have mental health services by the time I was done with my training, that I would like to at least help start it, or definitely help contribute and volunteer my time. And so there was another psychiatrist that was someone had connected us, and she was really interested in volunteering her time to help. Basically, this is helping patients that don't have any health insurance. So we started mental health services at Huda Clinic. We actually have we have also, so there's 2 psychiatrists. We've had 3 psychiatrists in the past, but really right now it's 2 psychiatrists, and we've had therapists that have volunteered in the past as well. Sometimes it's a little bit hard to find a therapist because actually we both go there like once a month, so there's a psychiatrist there 2 to 3 times a month.
Okay.
And sometimes the patients have a hard time coming more than that because of transportation issues. But what we have actually done, we're kind of partnering with another organization called Muslim Family Services that they already have therapists. Because see, this is kind of a medical model, but that's the unique thing about behavioral health, is that it's you're kind of combining both. There's the medical aspect of it, and then there's the behavioral health aspect of it, and you really need to have both.
Exactly.
I think we talked about this morning. We talked about psychiatric services, and there is a place for medication, but you need to kind of provide other services
Absolutely.
To help people.
Yeah.
So instead of trying to find a regular therapist because I think it was just too hard. There was a lot of inconsistency with the patients, continuity, I would say. So now we partner with Muslim Family Services, so we refer patients to them. So they have therapists that are there all the time. So, and they're happy to do that. And we've been providing psychiatric services. And, it's been really interesting because I think that the picture of the person that you think that does not have insurance, health insurance, is very different when you see that person than what you might have, the preconceived notions that you might have of such a person. You have people that have lost their jobs, that have that are between jobs, that are students, that are no longer on their parents' health insurance. Now, of course, there was a lot of changes when we had the ACA and everything, but there's still a lot of people that definitely, I mean, especially now when they're trying to repeal it and everything, but definitely a lot of people that kind of fall through the cracks. It's really complicated applying for like the ACA, and people need help trying to like navigate that system. So then you've got people that either had also already a history of mental illness or depression. They ran out of insurance. They're out of medication. They can't afford to see their primary care physician. They can't, they don't have any access to their medication or their care. And so that's kind of where we're able to come in. So at Huda Clinic, they provide primary care. They also actually have an ophthalmologist, dental services. And so now we are 2 psychiatrists that are there, myself and Dr. Sabiha Omar. And we actually also provide as much as we can. It's not fully extensive list, but we do have free medication as well.
Oh, perfect. So who's funding the Huda Clinic?
Huda Clinic is, I believe they have grants. It's like a nonprofit, but then also a lot of it is by donations too. There's several physicians that have donated their time over the years, and then also, they have like a annual fundraising dinner, and then just kind of throughout the year, they, ask for donations and funds, and all of that is 100% used to help patients that don't have insurance.
That's amazing. Yeah. So then back to before I continue, for those who are joining us, I'm interviewing Dr. Saba Maroof Hamzavi, and she's a psychiatrist in Michigan. Please like the video and share it. So we want to go again talk about the confidence. How do you think someone can undermine their ability to move forward, their ability to be confident, their ability to their own wellness?
I'm going to move this over a little bit. I had written down a few things, and I don't want to look like I'm not talking to you. Well, let's see. I think that, so, you're doing this talk series about confidence, and I thought it was really interesting because this is something that I think, like, on paper, many of us, that have been your guests on this show before, and then many people that are watching, on paper, you would think that somebody that has like a long list of accomplishments and are highly educated, you think that automatically confidence kind of comes with that.
Yes.
But what's really interesting, especially, and I would say as a female physician and other female physicians that I know, and my colleagues in medicine, especially women, is something that you're kind of always trying to master. This educational road is very long, and it's changing now, but it's not always supportive. I guess that there's and I think the culture's changing a little bit, but the old school way was, in our medical training, was sometimes a little bit not demeaning, but there was kind of like a hierarchy. And so many of us that trained, even within the past 10 years, were kind of privy to that. And it's kind of, there was many times, I think, in my own experience and in my training where I actually probably should have been more confident, but I wasn't.
Mm-hmm.
And even in my evaluations from attending physicians, from people that were supervising me, from my teachers, that was actually something that I got a lot as feedback, was that you're doing everything that you should be doing, but you self-doubt. You doubt yourself a lot. You kind of not really put yourself down, but there was a lot of self-doubt. And so, and I think one big way that women in particular can undermine feeling confident or even appearing confident is when you kind of do that. When you have an idea or when you have something to share, but we all have like that inner monologue, that inner voice that's sometimes putting us down, and when you're kind of giving that voice a megaphone. What was that?
Imposter syndrome. Like, I cannot do it.
Yeah. That's what I was going to talk about. Yeah. Exactly. So many of us I mean, even if we've attained any goals or all of our goals or have a long list of accomplishments, we might feel like this only happened because of luck or anybody else, that anyone could do this if they worked hard enough, or if they, if they put the time in, then, I didn't do anything special. That we're really not as great or smart as everybody thinks that we are. And exactly, that is imposter syndrome. And they say that men and women can have it, but the way that women deal with it is a little bit different. But you definitely see it,
Yeah.
in women. And I mean, even if you look at how like gender differences in learning and differences in the classroom between boys and girls, even up from a young age to even when you're like applying for jobs, it's like if you compare men and women, a female applicant might fulfill 8 out of 10 um, on a checklist, 8 out of 10 requirements for a job. And they're still going to, many times, it's very frequent, very common that the female applicant is going to kind of put herself down and actually be insecure about if she's even qualified to apply for that. Whereas oftentimes male applicants, they might only have like 3 out of 10, they might only fulfill 3 out of 10 criteria, but they feel very confident about it and they're just going to go for it. So there's something about females that we don't feel like we're enough. We don't feel like we've done enough. We don't feel like we're accomplished, or that imposter syndrome. Someone's going to find us out and figure out that we've just been faking it.
Where do you think this stems from? This for women, that the fact that no matter how much education they have, what they went through, or how much achievements, they feel that they're fraud. They feel that they are not up to the challenge. They feel that they are not confident. Where do you think? Why women? You think?
Well, I think that we have so many roles that we're trying to fulfill, and so many things that we're trying to balance at the same time. And I think it's really easy to feel. I mean, I know I've personally felt it, and almost every, especially mothers, working moms especially, have felt that. We talk about work-life balance, but it's like impossible to feel like you are performing 100%
on all levels. Wow.
Yes, exactly. Yes. And so, and I mean, we talked this morning about it, and I definitely was this morning was feeling that way.
Yeah, I really appreciate that you are with me now. I know how. I just want to tell you, thank you so much. Yeah, I want to mention it. Like you had vacation. It's Eid. It was yesterday. The children are going to school, so I can just I'm so much appreciative of you being here with me on live, because I know how much. So many things that you could have been doing now instead of being with me on the live. So thank you so much. Yeah.
Oh, no, that's okay. But I mean, I hope it's helpful. But I think that's what it is. It's like we have so many standards that we're up against. And we have like maybe just really high standards of ourselves, a sense of a level of perfectionism that you have to be perfect. We kind of mentioned this before, at everything that you're doing to feel like you're good at it. Yeah, exactly. So yeah, that's what I think. And actually, well, here's another thing I wanted to share this.
Yeah.
As we were talking about it. Well, I think that confidence also has to. There's standards that we have of other people, but there's standards that we put on ourselves too. And so it's like even when we attain that goal, even when we've attained many goals, we still might not feel confident. And I think we all have to. It's not as much as what we're proving to other people. It's kind of being comfortable with yourself and what you've accomplished or what there is left to do, and being comfortable with that. There was something that I just read right before we went on. It's called, and it was just like a little line. And it's actually this book that I was reading about imposter syndrome, actually. But I thought this was really interesting. But how you define and experience competence, success, and failure has everything to do with how confident and competent you feel. So how you define and experience that competence, success, and failure has everything to do with how confident and competent you feel. So it's really how you define it. And if you have this unattainable level that is impossible for anyone to attain, are you going to allow that to affect how you view yourself, how confident you are,
how you perform?
And if you do, yeah, go ahead.
Yeah, go ahead. I said, how you perform affect how you perform?
Right, exactly.
Yeah.
So I think a lot of it is knowing what you're good at, knowing your skill set, honing that skill set, being comfortable with what you don't know. And I know in medicine, we're encouraged to have continuing there's always this push for continuing medical education. I mean, you have to do it too. But at picking things that are going to help you, that and also knowing your learning style. So are you one that does well with an interactive style or reading? I'm actually doing one right now. It's like this huge book of like 30 really pivotal articles actually in child psychiatry. I'm finding it really interesting. But it's helping me because also when you're working in that environment, learning is different now too, because you can definitely, whatever you're learning, you can apply it right away.
Exactly.
And so, okay, my husband's watching the room. I'm just saying hi to all the people that are watching. I didn't know that people were going to watch from my own wall.
Yeah.
Hi. But utilizing anything that you're learning right away in your practice, and that's going to make you more confident as well.
Absolutely. It's I think it's a mindset also, don't you think? Like if we can change the mindset that I can do it, if we put our mind in anything, we can do it. I mean, some people do stuff that you don't expect them to do. Like when they were in school, they were called failures, or you're never gonna amount to anything. You're not gonna really achieve anything in your life, and you see them successful. I'm not promoting that people don't study and go to colleges and stuff like that, but I'm saying like some people got really successful because they were determined and they changed their mindset because they want to be confident and they want to be portray that, and they were successful.
Well, and I think it can go the other way too, that if you are a good student, if you did well in school, if you did well in that environment and you kind of learn to navigate that system, that you kind of might become used to those kind of that external validation, and somebody kind of always telling you, hey, you're doing a good job, or oh, I got an A on this, or I got a 96% or 100% on this. And obviously life is not like that. And so when you don't have that constant sense of evaluation, it's hard to kind of judge yourself. I mean, as a therapist, you're seeing clients. How do any of us really know that we're doing a good job? I mean, if you're working in a hospital, you have like Press Ganey and all these surveys and things like that. So I guess if you're in that kind of system, you might have something like that. But many of us don't have something that's kind of
you don't really have
in our daily life.
Yeah, especially like I'm in private practice, so I think
exactly
it's like you always gonna work on yourself to like continuous education, like you said, and also maybe when you see the result on how the client is really responding, on how things are going with your client. But also, again, the therapy depends on both. It's not only you. Also, the client needs to put the work, So it's kind of like it goes both ways, if you will.
Yeah. Well, that's really interesting because there's definitely times where I've had patients, and sometimes it comes out of nowhere. You've been working really hard with somebody and you feel like that they should be doing a little bit better than they are.
Yes.
But then they'll express to you that you're helping. I mean, I've definitely had this experience where a patient will express their appreciation.
Okay.
And I might not even expect it. I didn't realize that I was helping somebody in a way that was so impactful for them. And so that's one way that
Yes.
And I get that feedback. And I know many of my colleagues that are good at what they do get that feedback.
Yes.
That, hey, you know what, I've seen other psychiatrists, but you're really spending time with me. You're really taking the time to get to know me. And you're spending more than 10 minutes before you give me a diagnosis, which I'm like, oh, well, I mean, I think I should do that.
Yeah.
I should spend time with you. Isn't that a given?
Yeah.
But it's hard sometimes to find good care.
Yes. It's
so I appreciate it when patients appreciate it.
We all do when patients give us this feedback, because so you get this gist of what's going on. And I think we are always like, we're hard on ourselves, and we just need to see we see the results. But also we need to remind ourselves that it's not only us, it's like a collaboration between us and the client, and really the work the client needs to do the work. And actually I remember hearing this in one of my trainings, saying that if you feel that you are working harder than the client, then there is an issue.
Yes. Oh yeah. I've heard that, and sometimes yeah. I've talked about that with therapists too. Sometimes we'll work on cases together. And I'll say, it seems like we're working harder than
the client,
the patient or the client is.
Yes. And then I think we need to take a step back and evaluate. Is it like, does the client really want to work or not? Because if the client doesn't want to work, then what's the point, if you will?
Yeah, it can be very hard.
Yeah.
I mean, and I know we talked about this, but yes, you know, we use medications definitely when it's necessary or when we know it's going to help. But there's no magic pill.
No.
And we really try to work with patients on, you know, what are things that they can do to help themselves feeling better, whether that's behavioral activation. As moms, I'll tell people, okay, you know, exercise is really important. This is really going to help you. Let's just take baby steps. Let's, you know, just go out. I mean, literally, sometimes people are so depressed they're not leaving their house house at all. You know, just make it a goal to go, and when you go to check your mail, well, number one, can you walk to the mailbox and check your mail every day? And then after that, while you are checking your mail, go for a walk for 10 minutes. Just these little things, because we know medication, as I mentioned, again, will help, but you have to do some of the work, and you have to work on, and that's why therapy is important, looking at our patterns of thinking and the patterns that we're falling into, these automatic thoughts that go through all of our minds. But how are they impacting your mood? How are they impacting your sense of self? Are you constantly berating yourself and you don't even realize it? And that's why therapy is important, to kind of help you work with a therapist, and working with a therapist helping you realize what those thoughts are. What are ways that you're kind of almost self-sabotaging yourself? And I think this was one of your questions too, we were going to talk about, is how to instill confidence in other people.
Yes.
As we mentioned, or how to boost your confidence. As we mentioned, it kind of comes from within. But that is a big part of kind of what I do too, what you do as therapists, as psychiatrists, working together with people that are battling depression or anxiety. A lot of these are stemming from ideas that I'm not good enough, or I'm a terrible person. I mean, so many negative thoughts.
No one cares. No one cares.
Yeah,
that's a big one. Goes back to the family origin, or the parents, or the attachment style, or whatever that is, that you have to dig deep there and find out what is this stemming from, in terms of seeking outside validation instead of seeking internal validation. So I think that's also important. So again, for the audience, if you have any questions, please put them in the comment section. I see Anila here is joining us, Rasha, Tracy, thank you for joining. So let us know if you have any questions, and share this video, because Dr. Maroof Hamzavi is really sharing very important information, and someone needs to hear what she's saying. So from your practice, have you come across some stories where, like you mentioned, do you remember a particular story where you put the effort, but the client wasn't really responding, or there was no result, and how did you deal with it?
I mean, yeah, I'm sure
we all did.
Looking back at your case,
we all went through it.
We have a lot of success,
and we all
that's why when I have wrong. Exactly. And sometimes it's having that conversation, saying, you know, we've kind of tried everything that we can. What are other things that we can do? And so, you know, we look at do we need another opinion? Do we want to try? I mean, for me, sometimes if someone's it depends. Are they just continuing to do bad? Are they getting worse? And we look at the treatment. Is the treatment milieu, is the level of treatment appropriate for the patient? So do they need something a little bit more intensive? So I also work with, you know, I work with kids. One of the places where I work is Catholic Charities of Southeast Michigan. This is kind of more, it's not community mental health, but like, I would say it's pretty diverse in terms of socioeconomics. And so they might have a lot of social, any socioeconomic background, you can have a lot of social issues, but you know, difficulty, definitely. I mean, there's so many things: parenting, attachment, as you mentioned. But one of the things that I'll look at for kids especially is, well, maybe we need, as I mentioned, a higher level of care. So do we want intensive therapy at home, in-home therapy? And that's something that we'll definitely talk to the therapist, and oftentimes I found that if I'm feeling that way, I'll collaborate with the therapist, and the therapist is feeling that way too. And so we'll both talk to each other. And that's the nice thing about, you know, behavioral health, is that there's always somebody else that you're working with. It's not just kind of like I don't want to say burden, but you're not just doing it on your own. And oftentimes the therapist will feel exactly the same way, and they're really appreciative that I'm bringing it up, because sometimes people are afraid. Again, like as you mentioned, they're worried that they're doing something wrong. Why isn't this person getting better? Is it something that I'm not doing? and then we'll talk about it. What are we focusing on therapy? You know, have we kind of exhausted all the options for medication? And, you know, we'll say maybe we need a higher level of care at this point. So that means what we call intensive home therapy. So somebody coming actually in the home. And that's obviously, of course, very helpful. And what's nice is before you could only get those, I feel like in my training, it was very hard to find that kind of care outside of Medicaid patients.
Yes.
People that had Medicaid. Now there's agencies that are popping up that provide that care for patients that have insurance too, which is really, really important.
Helpful.
Yeah. And so I guess I try to have a network of different people of different professional backgrounds to be able to kind of run cases by or talk to and see like what are other services that they can provide. There's been a few cases that have really stumped me. And sometimes I'll talk to the patient and I'll say, you know, I have a colleague and maybe we can get a second opinion and make sure that we're doing everything that we can. And they're happy to do that. And actually it's really interesting. Sometimes I have sent patients to a colleague, and it's really not different than kind of what I was already thinking, which is kind of nice. It's, you know, like validating that I'm not missing something major here.
Absolutely. It's important to have this validation sometimes, just to feel that I am on the right track.
Yes, exactly.
Absolutely. Yeah. Again, for the audience, if you have any question, please let us know. Thank you for joining. I see Samin here, Fatima. Thank you, Fatima. Tracy. So if you have questions, let us know. Please share this video. Dr. Maroof Hamzavi is providing important information for all of us. And so
or even if you have questions about what a psychiatrist does, because I know that sometimes.
Okay. So sometimes people ask, so the difference between psychiatrist, psychologist, and a therapist. And those are usually, we hear that. So you go ahead, please, and see, you know, you can provide the.
Yeah, no, definitely. That's definitely a question that comes up. I was actually helping with a pamphlet that we were going to be working on to distribute at one of our mosques. We were working closely with one of the local imams here. Yeah. And that was one of the things that we included that information, because people do get really confused. You know, what is the difference? So a psychiatrist is, as I mentioned, I have a medical background. So I went to medical school and did all the rotations in surgery, internal medicine, and then electives. And I did electives in endocrinology, rheumatology, you know, the whole, 4 years of that. And then a large part of our training is we work in different milieus. So in an inpatient setting, I have like over a year experience working in those settings. And basically, and actually also in our training, though, I think it's important to note is that we are trained in different types of therapy as well. Cognitive behavioral therapy, psychodynamic therapy, interpersonal therapy, and there's so many others. And I think that, that's kind of important to know too, because oftentimes, even if we're not doing therapy ourselves, as a provider, as I mentioned, we're working very closely with therapists. We're supervising oftentimes therapists. Psychologists is a little bit different, but again, under the mental health kind of umbrella, and have usually gotten a PhD, and you can also get a PsyD and become a psychologist. PhD, sometimes it's a little bit more research oriented and maybe in academics. But definitely you have psychologists that are working in a clinical setting. And then therapists can be like a master's in social work. Therapist is kind of, I guess, a general term, but the letters behind the name will be like a LPC or master's in counseling.
Yes.
A good friend of mine is an art therapist. So they, they're doing therapy. Now, psychiatrists actually used to do therapy. Even in our area, in our training, we have to have a supervisor for long-term patients, for therapy patients. And so there was many psychiatrists that continued to practice. But unfortunately, actually, a lot of times because of insurance, and I would also say kind of high demand. For therapy, you really need to be seeing people in the beginning, definitely at least once a week, and then maybe after that, every other week. And if you're, it's hard to meet the volume if you're seeing people repeatedly every week. Exactly. I don't see people once a week because I have a lot of people that are waiting, and the caseload just you can't really do that. And therapists will often, I mean, there'll be therapists that I refer to and then they'll say, I'm full, I can't see more patients, more clients, because they're kind of peaked. Or, but having said that, I mean, as I mentioned, I'm trained in certain types of therapy, even like parent management techniques and things like that. And so you have to have that background because you still can utilize that when you have patients coming to you once a month or every other month. And again, conversing with the therapists that are working with the patient.
Absolutely. Absolutely.
So most psychiatrists don't do therapy, but some do. And I was going to say also, sometimes it's dictated by insurance too. Insurance is not always going to cover it. I had this experience, actually, a really bad experience, because sometimes if you spend enough time with a patient, like if I'm there it's supposed to be a half-hour appointment and it's 45 minutes, and a large bulk of that appointment was talking about stressors or relationships or whatever's going on. So you can kind of like add that on to your kind of like billing code. But I've had this experience several times where you do that and the insurance company will charge a huge, like much more than they'll usually, the patient is expected to pay much more than they usually would have been. And so it's like you're providing the services, but then literally sometimes your patient has to pay more for that.
So it's like
because
touching the patient.
So it's kind of it's like a double-edged sword. Exactly. So you provide the service. So it's, unfortunately, you are kind of dictated sometimes by insurance and just practicality too. Absolutely. As I mentioned, like how are you going to see somebody back?
Absolutely. So
those are kind of the main, I guess, differences.
Yeah. Also, I think psychologists do more evaluations than therapists.
Right.
Yeah, and therapists can be like licensed marriage and family therapists like myself, or LPC, like professional counselor, or mental health. So it's kind of like you said, there's art therapists, there's so many, and social workers, of course. So, what are your professional future plans?
Well, as I mentioned, I was thinking about, I'm kind of like at a crossroads. I took a little break from the podcast. It was just getting really kind of busy. And I'm kind of wondering if I should have one that's kind of more focused on mental health. So I'm kind of thinking about that. But as I kind of mentioned before, it's like kind of an ongoing balance. As many working moms and mothers and even fathers experience, balancing professional goals with personal and family obligations, and even goals that you have personally and with your family. So sometimes I have to kind of keep that in mind before I sign up for something, or before I bite off more than I can chew. So I guess I'm kind of at that point right now, making sure that, my kids are 12, 9, 6, and 3. And I'm kind of at this stage where I want to do more, but I don't want to take away from time from them. And that's kind of where, as I mentioned, the confidence in different arenas, right? I don't want to put my all in my profession and not be there for them. And if they're not succeeding in a certain area, then as all moms do, you're just going to blame yourself and feel guilty, right?
So we are so good at.
Yeah, we're good at that. What was that?
We are so good at that, blaming ourselves as moms.
Yeah,
as
exactly.
Moms, yeah.
So, so I guess professionally, I'm kind of at a crossroads. I work in various clinics, and it's working for me right now. I really enjoy what I'm doing. There are times that I feel sometimes a little bit stagnant, and I think that's interesting with any, not just medicine, but any, for anybody with a extensive educational narrative journey. It takes so much to get to that point where you're finally quote unquote done.
Yes.
Or you get, your degree, or you get those letters behind your name. Exactly. But there's, if you're like an achievement oriented person, sometimes you get to this point where you're like, okay, well, what next? And you feel this need to kind of keep pushing yourself. And so I've been kind of trying to just actually not hold myself back, but just kind of pause and just enjoy what I'm doing, and do the best that I can do in the settings that I am in right now.
Absolutely.
And there's a question. I mean, I'm always wondering, should I start my own practice? But professionally, I'm doing kind of what I want to do at this point. There's always a question like, should I go into academics? Should I go into private practice? But I don't have anything set in stone. But it's easy to get into the kind of like this pattern, as with any job, where you, like I mentioned, you kind of feel stagnant. And so, which I think can be good, because that can be a signal within yourself, like, do I need something different? Do I need to challenge myself a little bit more? And every time I think that, then every place where I work, and a lot of psychiatrists I know have this experience, they're like, can you give us an extra day here? Or can you give an extra day here? I'm really coveting my 3-day work week right now because more than that, I don't feel balanced.
Yeah.
So
That's
it's like,
good.
I want to do more, but I have to hold myself
That's
back.
good that you're able to do that. You know, some people are.
Yeah, I'm
That's
lucky.
good.
I'm really blessed.
That you're blessed. That's good. That's good.
Yeah.
So how can the audience reach you? Especially you have a podcast that's very exciting. So how can people, like, if you would like to put in the comment after this, in the comment
Sure.
section, like the link to the podcast, and how
Okay.
can people reach you?
Well, you mentioned that. I mentioned I'm taking a break from the podcast, but that's the nice thing. That's what's cool about podcasting is it's kind of, well, cool or good or bad. It's always out there.
It's there.
Like
Yeah.
As far as I know, it's not expiring. But you can find the podcast is called Unsung Heroes, and you can get updates and things like that on our Facebook page, which is Unsung Heroes Stories to Inspire. That's, if you search on Facebook, you can find it, and I can, as you mentioned, I'll write that in the link.
Thank you.
And then also, if you go through to podcastdetroit.com, they list all the shows there, and you can find it through there. I think it's / Unsung Heroes, and also on iTunes. Again, look for Unsung Heroes. I think it's Unsung Heroes dash like Podcast Detroit. If you put in Unsung Heroes, it should come up.
Okay.
And we have actually like 40 episodes. So I saw Amanda Saab was watching. I don't know if she's still watching, but I interviewed her. She was Master Chef. She was like the first visibly Muslim hijabi. Yeah, she was amazing, and she's continuing to do amazing work. And that was really fun actually about doing that is I used to record on Fridays, and sometimes I was really tired, and I was like, oh man, but I made a commitment. I'm ready to do this. And then the conversations would just be so rejuvenating and rewarding.
Wow.
So it was really, as I'm sure, you experienced too. I mean, you're doing this like on a Wednesday evening. So sometimes you're tired, but the work kind of
amazing.
Reinvigorates you.
Yeah, I do remember I used to watch Amanda Saab with my daughter. She was so excited because, she was the only hijabi on that show. Yeah. It was amazing just to kind of boost all these young girls. Like, you can do it. You can achieve something. It was amazing.
Exactly.
It was amazing.
I've had a few authors on there too. Henna Khan, who's written several children's books and picture books having to do with growing up Muslim or Ramadan. Nadia Hashimi from the DC area. She actually ran for Congress. And I don't think that she won the primary, I think it was, but she's amazing. She is a physician, and she's written several novels. Wow. So it was really good experience.
Very exciting.
Yeah, it was exciting. Very exciting. And just it's the guests that really make the show. I mean, I'm just there. Calvin is my co-host, so that's kind of, I think that keeps it a little bit lively. It's not just me talking. I think that would be a little bit boring. But I have good guests and an amazing co-host, so it's fun.
Wonderful.
And then to reach me, you can reach me on Facebook. I don't really have like a professional page, but you can just find me on Facebook. And then, or if you have any questions about mental health or psychiatry, you can email me at Saba Maroof @gmail.com. SABAMAROOF @gmail.
Thank you. Appreciate it. So at the end, what are your final thoughts to the audience?
Well, again, thank you for giving me this opportunity.
No, thank you.
I know that we talked, and I was like, I don't know what I mean, confidence is something that I am still working on myself, which is, again, like on paper, it wouldn't look like that, but I think it's kind of a constant struggle. I have been told that when you reach 40, that then you just don't really care what other people think. So I have another year and a half until I'm 40. So maybe I'll magically be more confident then. But no, I do feel, I definitely feel confident in the professional realm, because I really enjoy what I do, and I know what I know, and I know what I don't know, where I'm stumped and where to turn to for more help. And I would say that, like many of my colleagues, many of us, I see myself as a lifelong learner, and I love research and reading about clinical topics that I definitely utilize clinically. And it's fun. It's fun when you can take what you learn and read and, put it into action.
Absolutely.
And helps you.
Absolutely. Thank you so much for joining me. Thank you for taking the time. I know you are so busy and you had so many things going on, so I really appreciate it. Sharing your thoughts with us, sharing your plans and your advices with the audience. For the audience, please like this video, share it, And I will download this video on YouTube so you can subscribe to it also.
Oh no, I'm gonna be on YouTube.
Yeah, you'll be on YouTube. So thank you for the audience, and thank you to you for joining us. And until next time, you can also, I mean, I will put my links so you can join, you can reach me, and you can reach Dr. Maroof Hamzawi on the via Facebook or her email. And thank you again. I really appreciate it, and have a wonderful evening. Thank you again.
Thank you, everybody.